Whilst the ketogenic diet is commonly used orally, it can also be successfully delivered via a tube feed. This could be either as a powdered formula, liquid feed, or a mixture of different components to achieve the correct ratio of carbohydrate and protein to fat. Your dietitian will help you with detailed instructions on making up tube feeds. When preparing a tube feed, it's important to follow the instructions provided by your dietitian closely. Make sure to wash your hands first and clean the surface of your preparation area. Ensure all equipment is clean and dry before starting. Your dietitian will give you individual instructions on how much feed you require, either as weight of ingredients or as scoops. To measure scoops, level off the powder in the correct coloured scoop provided, ensuring the correct amount is added. If using scales, make sure to zero them between each ingredient. Ketogenic diet prescriptions are very exact. Add a small amount of warm water and mix to form a paste. Keep mixing until the paste is smooth and there are no lumps. Slowly add the remainder whilst mixing to the required volume. The warm water helps to prevent lumps in the feed. Your ketogenic tube feed can be covered and stored in the fridge for up to 24 hours. Once a feed has been hung, the maximum time it should be in use is 4 hours. When starting the ketogenic diet, your dietitian will try to keep your feeding routine the same. Ketogenic feeds can be a little thicker than standard feeds due to the high fat content. If a foam forms whilst mixing, allow the feed to sit until it has dissolved. If using gravity boluses, the feed could travel slower than expected, so experiment to find a routine that works for you. If using a flexitainer or bottle, sometimes the feed may coat the sides. To make sure the total amount of fat required is received, you may need to scrape the inside of the bottle with a spatula or rinse it with warm water. If using a feeding pump, it is important to follow the instructions on how to use your pump closely. If a feed is hung for a long period of time, the feed may separate. To avoid this happening, tip the container midway through the feed or stir to mix the components together again. MCT oil can degrade tubes and plastics, so after every feed, flush with warm water to keep the tubes clear. Ensure the syringes and jugs are cleaned thoroughly after each use, and the numbers on them remain visible for accuracy. Always be aware of your feed supplies so that you don't run out. Use products with the shortest expiry date first to avoid waste. Check that your delivery is correct and as prescribed. Due to the exact nature of the ketogenic diet, it is important that the products delivered are the ones you see in your recipes. Some products come in different flavors and ratios, so always check. Products that you may become familiar with include KetoCal powder, KetoCal liquid, Calogen, Liquigen, and MCT oil. KetoCal powder is available in both 4:1 and 3:1 ratios. The ratio tells us the number of grams of fat in the feed to every gram of carbohydrate and protein. If the wrong ratio is delivered, it will alter your fat and carbohydrate intake. KetoCal powder is available in both unflavoured and vanilla. KetoCal LQ is a liquid supplement which also comes in different ratios. The 2.5:1 version contains MCT. Calogen is a high-fat supplement that could be used to increase your fat intake. The neutral flavour version is likely to be prescribed as it is lowest in carbohydrate, but it is also available in strawberry flavour. Liquigen is a fat emulsion that contains MCT. It can be useful for adding MCT oil to feeds without worrying about the oil separating from the feed. MCT oil is more likely to be used in blends than in your ketogenic feeds, as it can separate in the mixture. Your dietetic team will oversee your delivery order, so if you feel you are not getting enough product or you need another prescription, discuss this with them. And always contact your clinical team for guidance. Nutricia provides a comprehensive ketogenic portfolio aimed at simplifying the ketogenic diet for both adults and children with epilepsy, along with their families. Nutricia Homeward is a free home delivery service that ensures your supplies are delivered directly to your doorstep, making it easier to receive the products you need. Starting the ketogenic diet can be daunting. Nutricia's specialist chef offers local cookery workshops and virtual cooking demonstrations. He also creates recipe books and cooking videos to support you on your journey. My Keto Planner is a free web-based platform for the ketogenic community. It allows you to find, calculate, create, and share ketogenic recipes, offering thousands of recipes suitable for all types of ketogenic diet. Additionally, Nutricia provides extra support designed to help optimize patient success while following a ketogenic diet, including printed resources and events which allow patients and parents to connect with other people experiencing ketogenic diet therapy.